Welcome to my today's presentation, OBSiDiAN, Regenerative Medicine in Surgery. My name is Thomas Geier and I am the CEO of Revolution GmbH based in Rosenheim. It's a great honor for me to introduce you today in this new thematic in surgery. So what can you expect by using OBSiDiAN in your clinical routine? We are talking about regenerative medicine as our product is stimulating the autoimmune system and therefore the self-healing competence of all your patients. We are producing 100% autologous biomatrix gained from blood, which improves and accelerates the anastomotic healing in the entire gastrointestinal tract. You have a temporary anastomosis reinforcement, and as long as you're using a standard stapling or suture device for your anastomosis, you have a reduced foreign body reaction. So what is inside in OBSiDiAN? OBSiDiAN ASG contains 40 different growth factors. It's 100% autologous, and all these growth factors play an important role in tissue regeneration. In our sample, you see in our product, we have a very high concentration of all the different growth factors and proteins like cytokines and chemokines, as we are taking them out from a 120 milliliter blood sample from the patient. All these growth factors play an important role to initiate and coordinate the healing in the healing cascade, starting from the adhesion until the finished wound closure. Special attention needs to be brought to the adaptive immunity because thrombocytes are interacting with antibodies. They bound special immune globulins. They secrete pro-inflammatory and pro-coagulant mediators. And what is very important and very unique to our product is the time kinetic. So we produce our product and the thrombocytes are kept inactivated in a fibrinogen 1 biomatrix, and we release them over a time period of 7 days. And this slow and continuous release of a high concentration of thrombocytes have a dramatic impact on the healing of the wound, which Dr. Bayer from the University in Kiel impressively showed in his studies. Very important is that our product is thrombin free because thrombin has a very negative impact into the wound healing as it creates an apoptosis so that the cell membrane, as you could see here, would be destroyed, and obviously this would have a negative impact to the overall healing process. So together with our creation of OBSiDiAN, we also created a new application way, the intra-anastomotic application technique, because especially in colorectal, the healing takes place in the submucosal area. So we needed to bring our biomatrix where the healing takes place. So you can see here, this is very easy to achieve and can only be done with a fully autologous material. So we, after resection the colon or the esophageal area, you apply it to the stump, and when you then establish the anastomosis, the product will be there where the healing takes place. Obviously, we secure then the anastomosis and also take and reinforce the mechanical integrity of our operation. So more information and surgery videos, as well as a detailed indication list, you will find on our homepage on www.revolution.de. So to summarize the benefits of our biomatrix, we have a high concentration of fibrinogen 1 of 25 milligram per milliliter. It's a 7 to 10 times higher concentration of platelets per milliliter. OBSiDiAN contains proteins like cytokines and chemokines, which have a major impact in intestinal anastomosis. We have a high elasticity. It's very user-friendly for surgeons. If you use our new application technique, you immediately face a 2 to 3 times higher burst pressure to your anastomosis. You cannot expect any staple line bleedings anymore. You have a complete sealing of potential microleaks created during surgery. You have a reduced foreign body reaction. And obviously the hot topic in colorectal surgery these days, These might be the autologous army to fight against the microbiome inside the colonic wall. What do you need in order to create OBSiDiAN? So you need a system from a company called Vivostat based in Denmark. You see here, you need a processor unit and you need an application unit. The process is fully automated. It's very easy. In a one box, you receive everything that you need in order to produce OBSiDiAN. So there is a prep unit inside. In this prep unit inside, you first, as you can see, you fill in a tranexamic acid and a citrate. After you go to the patient, take 120 milliliter of blood. Later on, you put then a pH 4 buffer syringe inside, and this will be also the syringe where your final product will then be inside after the manufacturing process. You put all these prep unit then to the machine, press one button, and fully automatically OBSiDiAN will be produced. The matrix is stable for 8 hours, so you are very flexible while manufacturing and applying our biomatrix. One very nice opportunity, and even for the future, there is a huge list of indications that can profit of this application is the code delivery option. So together with our biomatrix, we can co-deliver a third substance, and this substance stays where you apply it. So you can use stem cell derived from a fat or from bone. You can use skin cells, or any type of drugs like antibiotics and cytostatics can be delivered with our system and stay where they are. Where we were also taking a look and our attention is the different surgical techniques. So with our system, and OBSiDiAN, we can do all the different surgical techniques like open, hybrid, laparoscopic, robotic, endoscopic, even transanal and transoral. We will always have the right applicator for you to make the application to a positive experience for you as our customers. So what we have done, we have published in 2018 our first preclinical results. A randomized controlled trial is on the way. And since 3 weeks, we have submitted our first 101 patients to surgical endoscopy. So we hope it will be ready for you to read and investigate our superior results while using in colorectal anastomosis. For the time being, I would like to thank you for your interest. OBSiDiAN is a new and a novel technology that can improve the outcome, the patient's outcome, and reduce the leaks dramatically. So stay with us, stay healthy, and thank you for your attention.